On it today is the importance of upskilling your workforce in mental health. And as part of the session today, we're going to have Claire Montague, who's our senior subject specialist for social care sector. And we'll be looking at topics such as mental health awareness, what the current insights are with regards to mental health awareness, and some of the solutions that are in place to addressing mental health within your workforce and wider where applicable. Obviously, the effects of mental health across the past few years has been increased with everything that's going on, such as a pandemic. We'll also have a session from one of our account executives, Dominic Flood. He's going to give an overview on some of the different funding streams that can be used to upskill your workforce, especially around the mental health, but not exclusively to our mental health offer. We have the chat function open, so if you've got any questions or any feedback, anything you want to add into this, please use the chat function, and we'll be monitoring that right the way through the webinar. After the event, the webinar will be made available online. Instructions on how to access that will be sent out after the event. So I think if we're ready, I will pass on to Claire, who will take us through the first session.
Good afternoon, everybody. I'm going to introduce you to our portfolio of mental health qualifications in relation to continuous professional development and upskilling the workforce. But before I did so, I thought it would be interesting just to explore some mental health statistics. So Mind report that mental health problems are steadily rising within the population. In actual fact, 1 in 4 of us will experience a mental health problem every year. Certain groups are known to be more common to experience mental health problems, even though, of course, all of us can have a mental health problem. But these groups include Black or Black British people, women aged 16 to 24, and individuals facing multiple disadvantage. Now, this could be lots of reasons behind this because causes of mental health problems, as you'll know, are very complex. But particular experience, disadvantage or social exclusion could be a factor. 1 in 5 people experience suicidal thoughts, 1 in 14 self-harm, and 1 in 15 attempt suicide. Males are actually 3 times more likely than females to take their own life, and that trend has been steadily increasing since 2018, as well as more younger people taking their own lives. Administration, as you can see, of psychiatric medication is the most common form of treatment offered. So as well, I just wanted to touch very briefly on how the pandemic has impacted on mental health just generally in the population. So again, research undertaken by Mind, which built on some research they undertook very early on. So this was a survey they did in 2021, concluded that those who had existing mental health problems are facing increasing challenges alongside having further concerns for their future. So basically the pandemic has exacerbated their mental health issues. It's looking at almost a third of adults and young people feel that their mental health has deteriorated since the beginning of the pandemic. In actual fact, 88% of young people believe loneliness as a result of the lockdown has impacted on their mental health significantly. And something that interested me was that a fifth of adults at that time didn't perceive their own mental health problems to be serious enough to seek support. So what's clear from this is that services need to be able to respond to increasing mental health needs across the board. They need to clearly understand the impact the pandemic has had on mental health and how that will impact on the support that people need to receive. Next slide, please. So I also just wanted very briefly to touch on workforce wellbeing. Again, wellbeing is really important, obviously, across all of the workforce, all occupational areas, but the pandemic has really, again, once more impacted people's mental wellbeing across the health and care workforce. So the CQC report, as I said, been negatively impacted, and that's in particular because of challenges that the workforce have faced. So in relation to having chronic and excessive workload, being accessed or readily able to access support, and having to cope with unprecedented levels of illness and death. So all of these challenges have contributed or compounded negatively on people's well-being. So burnout, anxiety and stress and exhaustion is a reality across the health and care workforce. And if we're looking at the adult social care workforce, sickness rates have doubled between March 2020, so the beginning of pandemic, and June 2021. These long-term issues, there's always been issues in terms of staffing pressures, recruitment and crisis across health and care, but they have been exacerbated as well through the COVID impact, which is, putting more pressure on the workforce completely. Workforce wellbeing is really, really important. The workforce deserves to be well supported, not to be put under extensive stress. But obviously it will impact on colleagues, wider teams, and ultimately services users. So it's really, really important that we're looking at promoting the wellbeing of the workforce and looking how we can do it, because it really, really is an acute issue and will feed into many other workforce issues. Next slide, please. Okay, just wanted to touch very quickly on the NHS long-term plan. It builds on the 5-year forward view in terms of ensuring that mental health is a priority. So within the NHS long-term plan, many drivers, many strategies proposed. In relation to mental health, they've pledged to revolutionise mental health care through increasing funding. So looking at 2.3 billion extra funding in the year 23-24 and provision of accessible mental health crisis care, looking at increasing mental health care for mothers, and having further reach for children and young people by developing services within schools and colleges. Alongside this, they're extensively looking to extend hospital services as well as community-based provision. So the commitments there within the strategies. Next slide, please. Okay, so that's just a very, very broad overview of mental health, prevalence in the population, the impact of COVID, and the impact of COVID on workforce wellbeing. So it's about ensuring that practitioners working across health and care have the right skills to be able to respond. So now I just wanted to introduce you to a range of our qualifications in our portfolio that support mental health, and in particular ones that support continuous professional development. So you'll know the importance of continuous professional development in terms of it gives deeper insight and ability, that it refines skills and plugs those knowledge gaps. So it's about upskilling the workforce. It ensures currency, because obviously in a fast moving world, learning can become, or skills can become, obsolete because new emerging skills are required. So looking now at the influx more of people seeking support because of mental health problems, practitioners might be working in services where they haven't encountered that, but would now need to develop the skills to be able to adequately support these individuals and also support the workforce. So having good CPD supports progression, so it could support career progression, and it could also support redirection. So if someone wanted to branch out into a different area, in order to be purposeful, it must be well crafted. So it's got to be relevant, it's got to be accessible, it's got to be meaningful, and of course manageable. So as an award and organisation, we have developed a lot of qualifications in relation to mental health to support the developing and upskilling of the workforce, because we've worked closely across the care, health and education sectors to enable us to do that. Next slide, please. So here you will see our CPD qualifications in relation to mental health. I won't read through all of them, but you can see that they range from level 1 to 3. So we've got qualifications sitting at level 1, 2 and 3. But they look and explore mental health needs across the lifespan. So we have mental health in the early years. We have sorry, can you stay on that other slide? Mental health for children and young people, and mental health just generally. So from cradle to grave, the coverage is there. And there's some of the qualifications that are also looking at supporting workforce wellbeing. Just wanted to hone in on a couple of qualifications. So again, I'm not going to read through everything here, but this is obviously our level 2 certificate in understanding children and young people's mental health. And the key purpose of this qualification, the key coverage, is around looking at children and young people's mental health in context, range of mental health conditions they may experience, the impact of that mental health. So looking at children and young people's mental health in context, as we said, different mental health conditions that they may have and the support that is available to them. So we have suggested, as you can see, potential supporting products that could be taken alongside, and obviously this will be subject to funding, but they're not exhaustive because we have over 80 qualifications So you would choose these according to learner need. And we also have a range of preparation for life and work qualifications, which may well be relevant as well. So we just say, why would you use our products? Well, we do have in-house subject matter experts and a curriculum development team that can support you in your delivery, answer any questions or queries you have. We also are able to organise training, so that could be sector-specific training or assessor training in terms of particularly how you assess these qualifications. And we do have some partner resources available to assist in the delivery, for example, from Learning Curve Group. Okay, next slide, please. Okay, the reason I chose this qualification was to look in terms of promoting workforce wellbeing. So looking at mental first aid, and mental health advocacy. So this qualification is about supporting workforce wellbeing. So it's someone that's got an interest in championing workforce wellbeing. It begins by exploring mental ill health and factors that may impact, and looks at how to support individuals with mental ill health in a work environment, in particularly through how to create a mentally healthy environment. So, as I said, one that's really about supporting the workforce wellbeing. Now, these qualifications are obviously very relevant to working within health and care, but in particular, this qualification would go across wider organisations because it is about workforce wellbeing. Okay. Very helpful probably in public sector roles as well, the introductory qualifications we have in relation to mental health. Next slide, please. Okay, I just wanted to touch on our counselling qualifications because we also have a group of products that look at exploring helping skills and introduction to counselling skills and how they can be applied in a personal capacity, but also in a workforce capacity. So again, qualifications ranging from level 2 and level 3. The level 2 obviously provides that introduction. The level 3 it builds upon that and looks more around theories and concepts. So if we could just move on to the next slide, just to hone in on the level 2. So this qualification, as I said, really is about an introduction to what counselling is and how these counselling skills can be used in life and work, looking at different approaches underpinning it and appreciating the role of self-development. So again, if looking at counselling within the workforce in terms of working with people doesn't qualify people to be a counsellor. None of the qualifications we have will qualify them, but it's given that introduction and that background around helping skills. So relevant if you're working and providing direct care, or also if you're looking to support the workforce. Okay, so you can see again, we've identified progression opportunities and potential supporting products, but very, very much aligns to your learner needs. Okay, that's it. Thank you for listening. So I'll now hand over to Dominic. Thank you.
So I'm just going to have a chat around the funding that is available for the qualifications that we offer. Specifically to start with around adult education budget and European Social Fund. Adult education budget, obviously, that funds the delivery of the education and training for learners. Could just pop, not sure what has happened there. Just apparently gone forward, sorry. So adult education budget funds your 19 plus delivery, and that's your national adult education budget in the non-devolved areas. That's generally accessed via providers or colleges that have won a direct contract and may subcontract it out or use it themselves. There's also devolved adult education budget available across 10 regions of England now, and those areas are able to set their own guidelines, and this becomes important when occasionally the ESFA might defund something, because in the devolved areas they can still make a choice to fund that if they wish to. You might also have access in some places to ESF funding, European Social Fund, although as those contracts are due to end in March 2023, they are going to be replaced by the UK Shared Prosperity Fund. Look out for more information on that as we have it. I suspect we'll probably be doing a session on that when we have more information. The key place to find funding rates for the qualifications that you wish to deliver would be on the Find a Learning Aim site, and that's one of the government sites, and that shows you your drawdowns for the qualifications. It'll show you whether it's just a generic flat rate or whether there's any weighting, and all general useful information like that. Now, a key area outside of adult education budget, because that tends to cover up to level 2, is a national skills fund, and that covers a lot of the level 3 qualifications that people may need to train and to gain skills that are going to help them improve their prospects of work. So there was initial investment of 375 million in the 21-22 financial year, and that has been increased to 1.6 billion across the next 3 years. And the key area, as I said, for us today is that the National Skills Fund includes free level 3 qualifications for adults. So any adult who is 19 or over and doesn't already have a level 3 qualification can access hundreds of fully funded courses. It's part of a long-term commitment to get rid of some of the age constraints and the financial barriers for adults who are looking to gain that level 3 qualification and progress and upskill. There are over 400 qualifications available, and apparently my computer has a mind of its own. There are about over 400 qualifications available, and NCFE have 36 qualifications listed on that lifetime skills guarantee, and some of these do relate to mental health. So it's well worth having a look at those as part of the progression route that was mentioned previously. So your learners can go all the way through and get those skills that are going to best help them progress and achieve the outputs that they're looking for. From the 1st of April 2022, the eligibility was also expanded to include those who are on low wages or who are unemployed. And of course, this National Skills Fund at level 3 can be delivered in the workplace. What I'd say in regards to funding is that it's always worth having a chat with your account executives. We're here to help support, and we'll be able to walk through things with you, have a chat around what is useful and what is potentially the best way forward for you to help your learners. So that is the full funding rundown. So Andrew, I'll throw it back to you.
Thanks, Claire. Thanks, Dominic. No, thank you both for those presentations. I'm sure everybody will agree that there's some good points raised during the presentations, especially around the mental health statistics and actually the impact that mental health has on society as a whole, but individuals as well. Uh, I'm sure everybody has been impacted by mental health, not maybe not directly through people who they're related to or friends or family. So the importance is there. And I think it's just to cover that, obviously at NCFA as an educational charity and an awarding organisation, we look to ensure that we have the solutions and products that meet the needs of the individuals, whether that's relating to the mental health or a wider skills that people need to progress in their careers, their education, regardless of their age as well. And it's making sure we have products that meet the needs of all those individuals. I know Claire went through some of the products that we have got, and it's also worth taking note that them a lot of those products are built up obviously of individual units, so there is an opportunity to do individual units if somebody just needs to do a little recap or upskilling or CPD and within that as well. So that's something that if anybody's interested in, obviously that they can contact their account executive and ask questions about that. So it's not just about the big product, it's making sure that those products are fit for purpose for everybody and everybody's needs and how they need to access them. And just to finish off, and there's been no questions in the chat to go back to, but you say feel free. Anybody's got any questions to contact obviously their account executives or the relevant contacts within NCFE if you've got any questions moving forward, not just with regards to our mental health, but with our wider portfolio as well. So just to finish off, I just want to thank everybody for the time today. It's always good when we see people sign up for these events and actually take some time to listen to our views and our commentary on what's going on in the market in different sectors. As I said beforehand, information on how you can access a recording will be sent out after the event. And everybody who's signed up for the webinar will get those details. And I think if there's no questions in the chat, I just want to say again, thank you for attending and Hope to be in contact with people soon.